Kia ora koutou. I'm Dr. Sian Williams presenting on behalf of my co-authors discussing our paper that's published open access in Developmental Medicine and Child Neurology titled Prioritise Strategies to Improve Diagnosis and Early Management of Cerebral Palsy for both Māori and non-Māori families. Now, the diagnosis of cerebral palsy is a significant moment for families and can play a central part in shaping the parental role for many years to come. In New Zealand, like in many countries, this commonly termed wait and see period before a diagnosis is provided to the family can be a really challenging time. And this experience and the family journey can be a complex process to navigate. And with that, there are continuing opportunities for improvements in health service delivery. The overall aim of this study was to explore the needs for change and co-create prioritised strategies with a goal to support improvements around the diagnosis and early management of CP in New Zealand. We chose to use co-design, a health design method that values a consumer-driven participatory approach where families and healthcare staff work together in partnership. Co-design workshops were divided into discovery workshops, which were about sharing experiences, opinions and ideas on the topic, and prototyping workshops that centred on ideas around solutions. Now, around 1/4 of all children with cerebral palsy in New Zealand are reported to identify as Māori, the Indigenous people of the country. Therefore, we held 2 series of co-design workshops, with the second offered to families identifying as Māori and with children with Hokai Nukurangi, the Te Reo Māori term for CP. And that was co-facilitated by a local katiaki health support worker who helped with recruitment, guided the sessions using culturally appropriate protocols and following kaupapa Māori, and later helping with analysis. In total, 14 health professionals and 12 parents of children of ranging GMFCS levels and ages of provision of diagnosis of CP between 3 to 6 months of age were involved. And though it might look like we had fewer participants from our family cohort within the workshop, most of our parents actually attended both sessions, and we ensured that there was equal access or balance of parents and health professionals within each section. So the discovery workshops really focused on sharing and understanding the different experiences, and the health design team used a number of different activities to facilitate these conversations. For example, an activity where participants were presented a common diagnosis scenario to stimulate discussion, an activity where parents mapped out what works well and not so well in the current health journey, and empathy mapping of these discussions around common feelings and thoughts and needs around the experience. The prototyping workshops took these experiences and ideas forwards into planning out possible solutions, and this was facilitated by card sort activities that help map out these priorities, and then within our Māori focus workshop, an activity around creating their ideal whare or a Māori house to represent what an ideal service should look like. 3 overarching principles were identified to help guide future approaches to health service delivery related to the detection and early management of CP: working together, nurturing spiritual and emotional well-being, and equitable access. Now, within this, key needs were also identified within clinician and family communication, service provision, and information provision. Building from this, 4 tangible action areas were identified for improving service delivery, targeting developing an educational toolkit for families, regional early detection and management hubs, appointment and service navigation management systems, and the provision of pastoral support. Now, whilst some of these needs and strategies could be enabled quickly and with minimal disruption, others may require more significant input to enact, such as additional or redirection of funding and resources, or the implementation of regional one-stop shop hubs. So we encourage health services around the world to review the key needs that were co-developed within this study to reflect on their own services. And whilst they were designed by healthcare professionals and families in Aotearoa, New Zealand, many of these findings are likely to also apply globally. Of course, they still do need to take into account their own cultural and ethnic settings. Now, I would like to thank all of our families and health professionals involved in this process and the Starship Foundation for supporting this work. Thank you, tēnā koutou.